Yeah. Welcome to Threads of Enlightenment. As usual, I'll take this time, first of all, before we delve into the podcast, to thank my guests for coming and presenting to us, because I know they're showing up with things that I've deemed very expensive, and I want to honor them coming with those things. And I like to stop and thank them for it. And that is their time. Dr. Sturgeon, thank you so much. That time is such a precious commodity. Many misuse and don't understand the value of it. We see how they behave, and that tells us that they lack understanding in that aspect. And I want to thank you so much for coming and spending some of that quality time with us. The other is your journey. It houses so much. It was all the information of who you were and how it assisted you to create who you are today. And I am so honored that you're here to come and share some of that, be vulnerable so that we can become better students of ourselves from your lesson that you've learned, and we may become wiser as we occupy this place. We want to thank you so much, Dr. Sturgeon, for coming to Threads of Enlightenment.
Oh, thank you so much for having me. I'm really excited to talk to your listeners and to you today.
Thank you so much. Tell them the thing that you have given birth so far as to how you serve your fellow mankind. And then we will take this wonderful journey and learn a little more about you.
Okay. I am a clinical pharmacist, an author, and a burnout recovery guide. And for any of your listeners that aren't familiar with the term clinical pharmacist, a quick explanation would be if a detective and a scientist had a baby, you'd get a clinical pharmacist. I spend most of my time saying, prove it. Prove to me that this drug will work for this patient. Prove to me that this is going to be safe. And so I spend a lot of time being a detective.
That is awesome.
When I'm not in the hospital helping people as a clinical pharmacist, I am guiding people through recovery from burnout. And my story really comes into play because somebody was in the right place at the right time to take care of me first. When I had graduated from pharmacy school, I really wasn't focused on much except get a job and pay off my student loans. And I didn't realize that I had gotten into a burnout situation, a chronic stress situation that was so bad until I was in the middle of it. And I found myself at one point sitting in a Walmart parking lot, just sobbing and sobbing and sobbing. And this stranger, somebody that I didn't know at all, this little Betty White lookalike, knocked on my window, scared the crap out of me when she did it, and asked me if I was okay. And at that point, I had no pride. I just said, no, no, I'm not okay. I'm not okay at all. And she took a moment and she really looked at me, like saw me as a person. And she gave this little nod and said, but you will be.
Wow.
And then she went on her way. I mean, to her, it was just another night, I'm sure. But for me, it was a huge turning point. Just to have a stranger look at me deeply and say, with absolute conviction, you are going to be okay. And I was so convinced because she was so convinced that I found myself nodding back and saying, you know what? Yeah, I will be okay. I'm not sure how I'm going to be okay yet, but that's going to happen because she said so and she believed it. And, you know, so often I stop and think, how many times do the little things that we do, things that seem meaningless to us, have such a huge impact on the people around us and we have no idea?
Yeah.
Stunning, right?
It is powerful.
It really is. So then for me, because I didn't know what my journey was going to be, how I was going to get from burnout to not burned out, I started looking around and there really weren't burnout coaches the way they are now. And so I delved into my science training and I started looking at what's the science, what are the different recovery programs. I looked at spiritual programs and diet and exercise programs. And what I finally found a toehold to get myself started was when I came across the concept that you cannot recover until you know what you're recovering from.
Wow.
And once I found that concept, I was like, okay, that makes sense to me. So what needs to happen is I need to delve deep into like personal stuff. What's going on with me that is creating so much friction in my workplace that is creating this situation? What am I bringing to the table? What are they bringing to the table? And once I found those pieces that were broken, those pieces that were causing the friction, then I was able to work on them.
That is awesome. So let's go back, Doc, because I'm gonna hold it there. I'm gonna hold that space right there because we're gonna come back here because I want to know what did you discover. But in order for us to do that, we need to go back because what you discovered happened to you along your journey. So talk to us about your family upbringing. How was that? This is the first, if you will, the first lab I tell people that I spend some time in. And the scientists that are called parents, they began to run some of their theses and their paperwork that they have learned on us and exercise to see if so. So talk to us about your family unit and how was that?
My family unit was not, it was broken. I did not come from an ideal childhood. When you talk to my mother, and she's extremely proud of this theory, her parenting theory is that first and foremost, your job is to make your child fear and respect you. And then later you can add in the love. So,
see, one of the theses I'm talking about.
right. So for me, I spent a great deal of time in books and in my imagination and learning differently from the people that were around me that were available to do that. So I always grew up asking questions, looking for answers, because you cannot grow up in that situation without thinking there's got to be something else out there.
Yeah. How was your relationship with your father?
We were very Christian, actually very Mormon household, and divorce was not a thing for them. And for him, he couldn't divorce her and he couldn't tolerate her, so he took months and months away. So he was not there.
Sorry, I'm laughing. I'm just sorry how you presented it. Give me an opportunity to laugh, and I could not just. Yeah. Go ahead.
Well, no, I mean, truth is sometimes funny. And it just is what it is.
So how did he achieve the brief vacation, if you will, this brief sabbatical from the family?
His work allowed him to go for months at a time, take business trips and be away for extended periods of time. So he would show up and be there and then he would leave.
Mm-hmm. And how did that make you as a young child, a young girl growing up, feel when your dad would show up sporadically and then he would leave? How did you manage your relationship, if you will, within your dad and your mom as a young individual?
Well, a couple of things. On the plus side, I learned to become very self-reliant. On the downside, some of the rules that my inner child, my child at that time created to be a functional child was that nobody's going to be there but me.
Yeah.
So trust issues are a thing.
So that's why I told you hold that space, because we can go back because it came from somewhere and we're getting some insight as to where some of those things came from that you will actually have to deal with. I love how you said something about how the rules that this young individual created. I always say to people, because I noticed it in the conversations that I've had, and I've had over 200 conversations, and I noticed it in my life as well, that something within the family unit happens, and how that young individual being there interpret that individual will make what I call, and I tell people, life is a series of statement faith, the things that we believe as an individual. And this young person will say things within themselves, or it may come out verbally, as you said. I've learned something, I am on. And that statement that you made guided you for a long time. And you now perceive the world based on that statement from that trauma. And then we embark on our life. And it's not until we become adults that the story that we told ourselves to protect us at that time are the stories that become, if you will, have a better word, our nemesis that we have to face, and we have to sit down and have a conversation, because at some point it becomes destructive in our life and it no longer served its purpose. And so we have to learn how to let it go. And that is a difficult place to be. So talk to us, Tom, as you began to make these beautiful declarations as a young girl that are now guiding your life. And you made this, declaration that you're going to be this way. How did that begin to affect your relationship, not so with your mom and dad, but with others that are outside of your realm, families, friends, especially when you get into the school area? How did you respond having that declaration made already, and it's a part of your being as you move through life?
Right. So as a child and even into my teens, believing that I was the only one that I could count on meant that most of my relationships were pretty superficial. The one exception was my very best friend that I met when I was 10. His grandparents and my grandparents were friends. And so I would meet him on and off when we would change states to visit my grandparents. And he was the one constant that I was ever able to rely on from about age 10 to about age 30. And to this day, he is still my very best friend. But in my late 20s, early 30s, I started to really question the idea that everybody walks around alone. I was like, I'm not sure that's true.
I don't know. That's a painful place to be in a way, that we have so many billions of people on the earth, and I had someone put it this way: it doesn't make sense to go and gain all the wisdom up in the moon and in the woods and never come down. So,
Right.
I see how it relates to us as we are here within the billions of people around us, and we could still be in that mountain and in that cave with all these people around us. So here you had this constant, and you're moving through life. I want you to talk to me, Doc, about a little about your high school and how you mentioned you functioned in your high school, because I want to understand, why did you pick the field that you did, and how did it come about? So how were you in high school? What was high school like?
I was the smart, nerdy kid because smart was always safe. Regardless of who I was talking to, smart was always a safe place to work from.
Yeah.
Vulnerable, not so much. Smart, safe. So safe was where I lived. And that meant that I was the nerd. I was the science nerd. I was, the one thing I wasn't was a math nerd. I was actually really bad at math. But I that's where I lived, was in science, and all I wanted to talk was facts. Don't give me any of that mushy stuff. Just stick with the facts.
I love this. I'm sorry again. You're giving me these opportunities to laugh, and how you present it is really funny. So here you are. You're dealing with the facts. Now, what caused you to gravitate to the field that you're in? Did you make that decision before going into college or after? Did you make that decision, and why?
Well, I actually started pre-med, and I started for the money. I'll be honest with you. I was like, I will go be a doctor and have lots of dollars. That was my plan. And partway through this doctor's schooling, somebody's little kid threw up on me, and I switched to pharmacy that day. I was like, nope, this is not the field for me.
Oh man, that's beautiful. I had my background is healthcare, and my first was into home health, home HMOs. Would get them to get their accreditation. I was assisting in getting accreditation and so forth. So we would have to write all the policies and procedures and then go to the state of Florida to get our accreditation and go through all that process. And I went into skilled nursing facility, and my sister told me, "No, don't do that. You don't want to do that." And when I went into the aspect of the business many years later, that was the most humbling thing, because I never wanted to be there, because I said to my mom used to work in a nursing home, and I used to go with my dad to pick her up from New York when we were living in New York. And the place smelled, and I said to her every time, I would never come into this. I never want to be in this other place. Here I am working in this place many years ago after it started hit me what I said and released as a young man. And it's so funny what happens within that area that causes doctors. I know a bunch of doctors and nurses and stuff like that to look at, go, wait a minute, this is enough, I'm out, and change their direction right away. And it's really interesting, especially when you came to the skilled nursing piece. You have to have a love for it, because some of them, I would tell people when I would do some in-servicing and when new employees will come on, tell you this, I would say that this business will expose who you are. If you're here for the money, or if you're here for love of the love for this field, sure enough, those that were there for the money, when the stuff started to really hit them, you see them running, because it's a really it's a place where it can expose your sins, if you will. So here you are, pre-med, the throw up happened, you pulled out. Why did you go to that specific thing? I'm sure you knew about it, but who did you know, and what was that type of relationship for you to just run straight into that area?
Well, I pivoted to pharmacy, honestly, because I had this amazing chemistry teacher, and ultimately pharmacists have to take all the chemistries. We get them all.
Yeah.
And I had one amazing chemistry teacher that really got me fascinated by the whole topic, and the way that, when at its most basic, humans are electrical chemical machines. And so by affecting the electricity or affecting the chemistry, you affect the human. And so that conversation really was what pulled me to the pharmacy side. And I'm so grateful for it, because that's really where I belong.
Yeah, it when you come down to the pureness of who you are, you get to see those aspects of, and then you are able to look at life differently. You're able to look at treatment, medication, all of the other things with a different lens when you look at that type of, when you strip everything away, the body, emotions, and all that stuff, and see exactly what we are, as they say. it helps. I know it does myself. So here you are, you made your switch because of the influence of someone. I tell people, influence is a beautiful, powerful way to guide someone if you know about it. A lot of people don't know about it, power of influence and how to use it. Women know how to use it. A woman can control her man, her husband, or whoever just by a touch, and this bear will calm down, and she doesn't know how to. She doesn't have to yell, as the movie said. He may be the head, but I'm the neck. That is a power of influence, as they say. So here you are, your influence to go to this area. Tell me, when you arrived there, Doc, how did you feel as an individual living and now in this new space? How did it connect with you, the person?
So we're talking once I became a pharmacist then?
Yes. Mm-hmm.
Okay. So as a pharmacist working with my patients, I knew exactly that that's where I needed to be. All of the education and my ability to teach and my ability to support all just fell into place. It felt right. It just clicked like puzzle pieces falling into place. Where the problems ended up for me were friction points within my department. It was interpersonal things and places where my values were out of sync with my director's values, and some of my values were out of sync with some of my coworkers' values. And that's where my friction points ultimately ended up, because I'm pretty risk averse. I'm sure you know, being in healthcare, that there is black and white, but there's a whole lot of gray area as well. And I tend to stick as close to conservative as I possibly can. And when I've got a director saying, let's skirt this line a little bit, and I'm going, that's a little too close to illegal, and he's going, no, it's okay. And I'm thinking, it's not okay. Not for me. That's a friction point. And I'm very conscious of microaggressions. I find them very disturbing and upsetting. And we had a person that was of Middle Eastern descent within our pharmacy, and we had somebody that was almost over the line beyond microaggression into full-on aggression. And anytime I would try to step in, she would say, leave it alone, you'll just make it worse. And so I felt like I couldn't affect a change there, but I was watching what was going on with her. And for me, that just ate away at my soul, watching that happen and not being able to affect anything.
Yeah, you can individual that loves justice and be in healthcare arena. I had a situation similar happened to me, Doc. I was being groomed because I did the management piece of it, and I was being groomed, if you will. And we had a situation in this company that I was working for. A gentleman got shot, and I had to go to the hospital to verify that he was shot, because if it is all based on this particular diagnosis, and if we do that, we would lose a lot of money. So they were sending me to be the one to make that judgment call. So I got to the hospital, and obviously the patient is there, and I'm looking at this bullet wound inside his man. And I'm on the phone with my medical director. I said, Doc, it's a bullet wound. I don't got anything else to say. He said, well, you can't say that. It has to be something else. And I looked at him and said, I'm on the phone with him. I said, I don't understand what you're trying to get me to say. That what I'm looking at looks like it's a bullet wound. He said, no, you cannot say that. You have to classify it another way. And I said to him, well, that is out of the scope of my training. You are the medical director. I can't make that call. And as the medical director, I suggest that you come and say that, because I cannot say that. And I got called the head of the company, the corporation was in Washington, D.C. I was put on a plane and brought in before the suits. And they said to Primus, the reason why you can't sit behind here, and we've noticed it with you, is because you have a heart.
Right.
They said, your problem is you have a heart. And in order for you to sit here, you need to die. You need to kill it. And I remember looking at them and going, what are you talking about?
Right.
And they said, you have to die in order to sit here. And I said to them, I cannot do that. And I submitted my resignation, and I walked away from corporate America healthcare for many, many years, somewhere about 10 years. I took off all the products, the suits, the watches, everything that to me that represented corporate America. I took it off, and I did not wear any of that stuff for close to 10 plus years because I didn't want to associate with them. So I know what you were going through there. It is a hard place. It can damage you much because of what it does to your spirit man, your internal you. So talk to me about how, as you began to see this and it begins to work on you, because I know that because I began to change. How did it affect you, and what did you do?
Well, ultimately, that's what drove my burnout is, just that constant friction and knowing that there was no way that I was going to be able to fix this. The more I tried to, make little inroads here and there, the more I realized that this was not going to happen because it was basically my personal integrity was being challenged constantly. And for me, integrity is a core value. You have an unwavering moral compass. At least I do. And so for me, I just ultimately did have to change jobs there. There have been times when I've been able to overcome friction or create or negotiate situations where things have been better. But when it comes down to actually challenging a core value, I couldn't stay in it. So I did have to make a change.
It is painful. I knew I had to walk away because, Doc, it brought me to a place where I was getting, it was messing me up. I was getting internally damaged because that was just one incident. I can go on and on and on with the birth of the HMOs at the time when people were getting denial of claims and denial of things. And it was a constant attack on your belief system.
Yeah.
Day in and day out. And it's hard to be there and try to find a way to interject some type of change. But that monster, it's a pretty big monster. And the leadership there need new vision, but most of them are also controlled by the monster. So I get it. So as you moved and you took this burnout, and when we started, you said you came to this space, and then you had to learn about a few things about you. As I'm bringing into the situation, you started to talk about, and I briefly held you there. So we are here, Doc.
All right.
And you are now in the burnout phase, and you began to now look at yourself, to investigate yourself as to what baggage am I bringing with me. Talk to us about some of those discovery that you started to see within yourself.
Right. Well, the first thing I did was I started looking at my personality attributes. Am I an extrovert? Am I an introvert? If I'm an introvert, how is patient facing working for me? And ultimately, that's why I ended up in hospital pharmacy rather than retail pharmacy rather than community pharmacy, because having patients coming at me all day long, as an introvert was a real struggle for me. And so I had to acknowledge that even though I wanted to be patient facing, that it wasn't healthy for me to be patient facing. And I had to acknowledge that piece, that was something, an idea that I was going to have to let go of. Either that, or what I ultimately ended up doing was giving myself a little bit of a barrier. I spend most of my time talking to my patients on the phone or on the internet, where I can get a little bit of a breather so that I'm not wearing myself out in the process of helping the people around me. And that was another thing I had to come up with, was setting boundaries. Where do I stop giving so that I'm not giving to the point that I no longer have reserves? Where is a healthy stopping point for me? So all of those things. And ultimately, I really did have to come up with the concept, or at least embrace the idea, that I'm not alone. It is okay to ask for help. And even when I ask for help and I get a no, it's not no because you're not worthy. It's no because I can't help you right now. And that's a big, like, mental click for me. Because as a child, it's when you get no, I'm not going to help you, it's you believe it's because you're not worthy of help. And so then as an adult, you have to, kind of flip that switch, or at least make that understanding for yourself that it's not about self-worth. It's about the other person's ability.
Perception, as you say, you have to change your perception of the situation. And I tell people that is the key to how long you stay in any situation, is once you change your perception of the situation, the darkness is gone away, because you are now switching how you were looking at it first. And then once you switch and you move, it now becomes something that can assist you to achieve what you want to, but you don't notice it unless you switch your perception. My son was a pharmacy tech, and he would tell me at CVS about the million coming at the window and how he lost his mind. And he also had to switch to the hospital because he said he was going to kill them, because he couldn't, that's not his personality.
Right.
His personality was a little more, he had to go behind the scenes where he wasn't there, and he was able to flourish there. But yeah, he would home. I remember he coming home and talking to me about some of those stories, and how he would had some excellent opportunities to voice his opinion in some languages that almost got him off the carpet a couple because someone pushed him too far. So yeah, I've been there, and I know that I couldn't do that service part as well. So I did not go into the business from that point of view, because I knew as a young child I'd be in prison, because I didn't have the fortitude to deal with someone like that at all. So I tip my hat off to anyone who could do that. So here you are, Doc, you're learning some of those things that you notice as a child, the rejection piece, if you will.
Right.
Talk to us about others that you started to notice, and how did you, by switching your perspective, what other tools did you utilize to help you to get through some of those investigative dark spots that you found within yourself, that you realize, wait a minute, I'm bringing this with me at this time and this age?
Right. Well, when I was working through my burnout process, like I said, I kind of just borrowed a little bit from everywhere. So I looked at addiction recovery programs. I looked at the science behind it. And Christine Maslach and her team are the foremost experts, scientific researchers in the realm of workplace burnout. And so I went to their scientific studies and took a look at what they were doing, and the various workplace points that they were pointing out, that friction areas where you're dealing with things that are unfair, or friction areas where you're dealing with things that are a mismatch to your personal values, or friction areas that you feel like you have no control, no autonomy. And what they were doing and how they were measuring those things really became a piece that I pulled in as well. So I used their diagnostic tools. They've got several. When I work with my patients, I have a tool that I've kind of tweaked for my personal use that's based on theirs. And pretty much I just started grabbing diagnostic tools, personality assessments. They're, they give you all kinds of background as to how you handle things, conflict resolution studies, pretty much anything I could get my hands on that was even remotely related. I would pull those in and pull little bits and pieces of knowledge out and kind of combine them together to finally come up with a 5-step program that worked for me very well. And that's pretty much what I've been using going forward.
I always tell people, and I mentioned to you, Leah, in the onset, that
Mm-hmm.
we go through the journey and the principles are there. It's out there. People have
Yeah.
it and designing and finding and fine tuning and playing with it. And each one, I believe, every one of us, all the billions on the earth, and I think it's going to grow. I heard the data a few days ago stating that it's going to increase as far as how many people are on this planet. I believe that the scope by which we all can pull out aspects of all these principles is what turns me on. It gets me excited because I think as everyone goes through it, their journey, and then they start pulling, you start pulling from all of these different principles and tools out there, and then you put it on. It's you make it so that you can understand it. Because what happens, as I said earlier, once you begin to understand it, it becomes truth to you, and once it becomes truth, then it'll become more effective, because the principle is that the truth will set you free, not facts, the truth of the situation. And so here you are, Doc. You pull all of these things together. You came up with your 5 steps. I had teaching about how Western civilization loved those 5 steps, because we need guidance. We're so, all of us, we're just running from a million miles away, and a million miles an hour, that if we don't put it down this way, we won't read it. We just won't read it because of how we've been trained.
Right.
So you've narrowed it down, you put it down, it fits you, you began to enjoy it, and you began to live from there. Talk to me as to the journey of the book. What, how, and when was it created, and now what process led you to the book?
Some people say they stumble into their jobs. I feel like burnout recovery kind of hijacked me. I was not prepared for that. Kind of kicking along, doing my own thing, and then 2020 hit, and we've got COVID, and all of the hospital workers, me and my co-workers, were pretty much living at the hospital at that time because nobody wanted to take COVID home, and we had so many patients coming in that you'd go home and you just get called right back in. So we just gave up and stayed. And everybody was just dragging and struggling. And I felt like I was holding my own. I was struggling like everybody else, but I felt like I was holding my own. And one of my coworkers came to me and he said, "Hollie, tell me what to take for sleep. I need something that'll let me get some sleep, but I got to still be able to get up and work if an emergency comes in the ER. What can you do for me?" And, being a pharmacist, we ask questions. That's our job. And being a clinical pharmacist, I ask skeptical questions. So I'm like, "Why aren't you sleeping?" So we get down to the nitty gritty of it. And it turns out he's not sleeping because he can't turn his brain off. His brain is just running and running and running, and he can't slow down. And so we started talking through my burnout and how I got there and the different pieces that I went through. And we looked at the stuff that was working for him, and we looked at the stuff that was absolutely not working for him. And we kind of mapped a pathway forward to work on the stuff that could be worked on. I forget who said it, but the idea is to control your controllables and let the rest of it go. And so we looked at the controllables. What could we actually affect? And we put a plan in place, little mini goals that we could actually do so that he could, get some rest. And then, of course, I gave him some melatonin and sent him off to bed. And the next day, 2 more people showed up in the pharmacy and said, Eric told me what you did for him. Do it for us. And then the next day there were a couple more. And the next day there were a couple more. And pretty soon I had to write it down. I had to write it down because there were too many people that wanted the answers and I didn't have enough time. And once I wrote it down, we realized it was a book.
Wow, that's awesome. Isn't it something? And again, listening to your story and your journey is everything that I talk to the folks about. The purpose of us going through our journey is so that we can find out what is it that makes us tick. Why are you here on this? And so when you walk into the space of a servant, it's then you realize why you're here on this earth. And as you serve, you truly get a glimpse of the greatness within people. And as you are saying, and you are able to guide them, because most of them are just coming for the pharmaceutical stuff, to knock out and get back up and run the race, get into the system and stay within the system. But you had learned a few things. And there's a principle that we are able to comfort those with the same comfort that we have received. And so, because and I tell people this also, Doc, that people are picked because they can be trusted with the journey and what they do with the information from the journey. Some people, I've met them that hold it and don't utilize it. And that to me is the saddest thing. That's an individual that has lost their way, if you will.
Yeah.
Don't understand their purpose on the planet. And so because of that, they are constantly stealing and they cannot help themselves. And so, but when you are truly trusted to be able to go through your journey, assimilate the information, and then put it in a format by which you can serve, that is life. That is life. That is life. That is life. And so you were able to put down those words to principles that you've learned into a book, and you were able to put it forward. Talk to us, talk about, because 2020 you're in the midst of it, man.
Yeah.
With all of the different books, and we got a chance to see the healthcare, the individuals within that industry, what drives them, the love that they have, the passion that they have for what they do, the things that people don't pay attention to, the value that who they are. We got to see the chance of the value of how important the smallest and non-essential of all the persons within that field and what you do. And I tip my hat off to you because I know what it did. So talk to me about some of those reports, if you will, as you began to gain more and more people coming to you. Talk about some of those stories. You talk about the very first one. Talk about others that once you educated them with 5 steps, how they were able to manage their life and change their trajectory.
Well, most of the people that I started with are in a really good spot now, which is lovely to see. It tells me that we're on the right track. And it's not an easy journey. Let me just say, nothing worth doing is going to be easy. That's a given.
Yeah.
I think the hardest part is to accept who you are. And when you start really looking at burnout, because it has to do with your friction areas, the things that create friction for you as an individual, everybody's different. So I can be standing next to a coworker and something that bugs them may not bug me at all. So it may be driving their burnout and not affect me in the slightest. And so everybody I work with is learning and accepting who you are. So it's really about self-acknowledgement. Sometimes you don't want to believe that you have a setback because you're driving it.
Yeah.
Sometimes you don't want to accept that what you believe is not necessarily the truth. So, and then part of what we had to come to was a realization as a group that in some ways healthcare as a profession is broken. What we expect from our healthcare providers is inhuman in some cases because we expect them to be perfect. And as a healthcare provider, you expect yourself to be perfect, knowing that you're not, knowing that you can't save everyone, knowing that you can't convince everyone that science is real. And COVID, wow, there were so many people saying it's not real, it's not real. And I'm like, look, I get you're coming from a place of fear here, but at some point you have to recognize that just because you don't want it to be true doesn't mean you're not at risk. And just because you're young and 20 doesn't mean you're not going to die in my ICU because you decided to have a COVID isn't real party with your buddies. And it was hard for all of us to look at that and accept that, yeah, healthcare is kind of broken in the way it treats its people. And then they turn around and tell us it's not broken, which then creates cognitive dissonance, right? Because you're like, but they're saying it's normal, but it's not normal. It's not normal to work your people 12-hour shifts. It's, there are a lot of things in healthcare that just aren't quite right. And we had to come to the realization that what we were seeing was what it was, not what we were told it was.
Yeah, the machine, and I don't know how we are going to, especially in the Western world, not so Europe, America. Europe also has some of the things, but they're much more open-minded in certain approaches that they're willing to in some cases. But corporate America machine, when it comes to care, is that we're all disposable. I mean, there are so many of us out there that says, so they're looking at us as disposable things, but they're running into a problem now because I think COVID, what it did, it opened the eyes of people to begin to see their value, and people are reevaluating their purpose and the value that corporations have paid to them. And that is why you're seeing, even though they had a nurses shortage forever, they've been having a nurses shortage for every year I knew healthcare. But now they're seeing that the purpose of these men and women that are walking away from something they love is because the corporation don't see the value and is willing to make the changes that are necessary to incorporate their value. And so you see a lot of people walking away from professions like nursing, like teaching, from those powerful, influential industry. So until someone in the corporate world can reimagine that, I don't know how it's going to proceed, because what keeps them moving is that they see it as a business and it's not a thing that deals with the citizenry's healthcare, and the politicians play games with it.
Yeah.
I've never seen gravity in my entire life, but I know that if I jump from a building, I'm going to understand that it does exist.
Oh, yeah.
And so people with their madness, they have surrendered. I would tell them, you have surrendered your logic, and they have become emotional with where they need to be logical in a situation. And so there's nothing wrong with emotions, but where you use your emotion in your decision-making pattern will determine whether you live or die. sometimes you need to put your emotions and take it out of situations that governs your life, and you would have to go with some of the logical approach. And guess what? Science is pretty logical, and it has proven itself many times. And those are the same people that were getting vaccines. They, half of them put their arm up and they have vaccines on it. So I would always look at that, and I found that argument and that dissertation, if you will, that those folks were driven by ignorance, but also by emotions and not by facts. And you have to put emotions down when it comes to situations that allow science to guide you. Science is not perfect, but it's able to guide you. And it's either emotion, and you can ask the questions, you can be honest, not reactional. And that's the part I never liked about it. They weren't honest. And to have a real conversation as to the newness of the vaccine, all of those things. It was okay to have the conversation, but they were driven emotions, and it made it ugly.
Right.
And a lot of people died as a result. So it's just absolute madness. So here you are, Don. You've gotten this product together, and you're able to share with your staff as are looking and having this conversation about the healthcare system. Talk to me about that, because I know that's a tremendous beast. What were some of the conclusions that you guys are coming to as you are in it? I've been out of it for a little while. Well, you're in there. What are some of the whispers that you're hearing from those that are above that can make decisions to change the system, if you will?
Well, what we're starting to see, and I think that you've nailed it, that we've got enough people that are starting to leave the workforce now, that the employees are starting to have a little more power in this power struggle. What we're starting to see is we're starting to see at least lip service, if not actual let's do it, but at least people saying we should be doing it. Care for the caregivers starting to show up, and people are talking more about setting boundaries, taking care of yourself, stepping back, and putting these resilience measures into place to at least help build up your reserves to keep you from basically burning out. Because from my perspective, there's two kinds of burnout. There's the burnout that's driven by your workplace squashing you constantly. And then there's the burnout that's driven by you when you're the one driving the bus, because you give and give and give and give until there's nothing left of you. And so you have to put those markers in place. You have to put those boundaries in place and then stick with them. And the nice thing is corporations are at least starting to say that they recognize that this is the case. Now, whether it's because they feel like they have to in order to retain their people, or whether they truly believe it, I guess it depends on how skeptical I'm feeling that day. But at least the conversation is being had. So I think that's progress.
Yeah, I think they're nervous because the money getting, people are walking away. Like I said, I've been in healthcare. My mom, family, tons of them, all of them have tons of family friends in the business. And just like teacher, there always have been a shortage of nurses around in healthcare, but not like this, where people are walking away from it by the thousands.
Right.
And so when they are doing that and they are in this quagmire, if you will, and when the bottom line is being challenged, they're going to have to do something. And this is where, quote unquote, the lobbyists in a hospital system, if there's a way to get them, it has to become law for these guys to do it. And when it becomes law, they still will have the minimum and the maximum, and you know how that goes.
Right.
The minimum is just the bare bone, and they will try to manage it with the bare bones. But I hope they do recognize it, Doc, because you guys are still there and is a great need. And the onus comes on the individual, as you say, they're going to have to learn how to manage their selves and develop boundaries. And maybe in doing so, you probably force the hands of these systems to begin to really truly have honest conversation. Because I think when you begin to those boundaries is when they're also, those boundaries will affect their bottom line, because those boundaries are dealing with taking time, taking more time to do this, taking time to heal. All of those things come into play. And these guys are going to have to be forced to reimagine the system. I love that system. I want to tell you, I love healthcare. It's such a beautiful place to be, and you get to see some of the greatest people on the planet there, the givers, as I said, and they're special folks, man. I want to thank you so much for coming to Threads of Enlightenment. You are a special being because you're there and you have gone through your journey and you have developed something in the form to assist your fellow workers who were trusted with the journey, and you are showing honor by serving your fellow employers and friends and colleagues and all of those folks that you, and those that are listening, purchase the book. Those principles are in that book to help you in your current situation, whatever industry you're in, and you are not happy, you're having these conflicts within yourself about your position, about running into all of these different parts of the system that come against your belief. The doc has information that can assist you in that journey. And the holidays are coming up. Purchase book, give it to someone so that they can learn and free themselves from the stresses that they are in currently, so that they don't have to experience any type of burnout, as we hear from Doc. Doc, thank you so much for coming.
No, thank you for having me. It was a privilege.
It was an honor to hear your story, Doc, and I really appreciate your time. And I will sing it to the loudest mountaintop. You guys get her book, and let's support her and support our friends and family so that they can be rescued from their situation.